Hey, I'm Dr. Sebastian Gonzalez with Performance Place Sports Care, and today we're doing a video to correlate with a video, or actually a podcast we did, session number 53 with Dr. Justin Dean, and we're talking about plantar fascia or foot pain and the correlation with extension of the big toe. So if you listen to that podcast, you'll hear the reasons why we're doing this. If not, you might not care about this whatsoever. But what I'm going to show you in this video is how to test for active and passive range of motion. And then we're going to go over some corrections and how to just basically analyze what the possible issues are with the big toe. Okay. First off, I'll just give you a quick preface, is if you don't have good extension of the big toe, then there's a strong possibility you could have plantar fascia or bottom of the foot pain, because this is part of the mechanism of how the foot works. Now when we test passive, we're testing ligaments, cartilage, and joint. Okay. And for the most part with this one, we'll stay down here actually. You good there? Okay, so for this one we're going to test this joint right here. So all I'm going to do is just simply pull it up. I'm going to use this as like a fulcrum, my thumb. So right now this looks like a normal range of motion. Okay. Now if I wasn't able to move it whatsoever and it's stuck here on the ground like people with bunions, then we have a loss of passive range of motion, which means that we have to do some corrections to improve that joint ligamentous or cartilage function within that area. Or we can do if you do as many, you can do as many exercises as you want to, and a lot of times it won't improve this range of motion. Now, with the with active range of motion, we can test. Now, we're basically just going to try to separate the toes. So the big toe comes up, and you see that I can get it just about as far as I did when I was pulling it up with the other toe. So I'm actively moving this. I'm doing it myself, which means the muscles of the foot on top here as well as the calf or shin are doing the work for me. So this is normal on both regards. Now, let's just say if I have normal passive range of motion, but I can't move this up whatsoever, then possibly have an issue with the muscles or tendons attaching to it. In that case, we might do facilitated corrections. What this could look like, and you don't have to use a band for this, but I will because that's just what I have, is sometimes the person has a little bit of strength to do it, but not a lot. So we have them actively do it, and you can see the tendon of my big toe pulling up on it. Now I'm just going to help it out a little bit with the band. And the band doesn't provide resistance, it provides guidance to getting it to the full range of motion. Okay? Now on the other hand, perhaps we want to strengthen it. You could do something like this. Now the band is creating some resistance against the tendons and muscles of the foot. And there's probably a more efficient way of doing this, but for this point in time, this is going to work. Tension it and pull it up, and you'll feel it start to burn right here. Now, going back to the possible loss of passive range of motion, say I can't move it up to here, even with yanking on the thing, that means I can't move it up past that with active range of motion either. So the typical remedy is going to be to address the capsule and some of the musculature and tendons down on this side. So what I would typically do is I would grab the capsule right here and I would pull the toe back into the range of motion that I want with the other hand. And after spending an adequate amount of time on the capsule there, I would move to the muscles attaching to the big toe. And this is just a couple of them. There are some up into the calf. I am aware of that, but we're not going to do that for this video. Okay? And sometimes it takes more aggressive stretching, such as PIR or something of that nature, to do the job too. So whatever remedy improves the passive range of motion, you have to get it before you get the active. So, and if you listen to the rest of the podcast, again, it's on p2sportscare.com/podcast pound 53. You'll find the reason why we're talking about this, because people have consistent foot pain, and a lot of times when they don't address a simple correction like this, it's not going to go away. So you need to make sure you address this first if it's lacking. Again, find all the links below this video. I'll talk to you guys soon.